First, the importance of early screening for breast cancer. We are joined by Janet Kramer Mai, who's the manager with Erlanger Center for Breast Health. And really, right off the bat, how important is getting a mammogram, and really, how often should we get a mammogram?
Extremely important, and annually. Between the ages of 35 and 40, a woman can have a baseline mammogram, just meaning her first. After the age of 40, it's recommended to have annual screening mammograms.
And, what age should women start considering or needing to go to get that mammogram?
Well, between 35 and 40 is when insurance will cover the baseline. After 40, we like to see you every year. Breast cancer is one of those things we cannot prevent. We don't know who's going to get it. We know there are things that increase your risk for the disease, but even absence of all those risk factors, women still can develop breast cancer. So the goal of having them come in annually is that if something develops, we can catch it early.
Now, we've got some new things that are happening at the Erlanger Center for Breast Health, and really, tell us a little bit about this particular center.
Erlanger Center for Breast Health is brand new. We're just getting open and getting the kinks worked out, but it's very exciting because it's an imaging center where all we do are breast procedures. So we have 2 mammography machines. One is brand new. It does actually 3D, what we call tomosynthesis images, which is brand new to this area. There's one other unit in town. So 2 mammo units. We do breast ultrasound, and we have a DEXA scan, so all very specific to women and mammography, and it's all we do all day long. So,
and some of the things that you're describing, is that a difference between a regular imaging center?
Yeah, a regular imaging center, there's going to be people in there for MRI, CT scans, other kind of ultrasounds. So mammography is a piece to their bigger puzzle. For us, it's all we do all day long. So I have wonderful mammography techs. This is all they've ever done, and it's all they do from 8 to 5 every day. I have an ultrasound tech that's at breast ultrasound is what she does. My radiologist, what she does all day long is sit in there and read mammograms. So it's a specialty shop for breast imaging.
Now, when it comes to getting mammograms, I know oftentimes it's hard to start thinking about that at an early age. The same thing for the guys as well, for some of the testings that we should be doing. Why is it so important? And maybe is there a fear? Is there a reason it's not happening as much as we would like to?
Really, yeah, we fall below national averages on women getting their mammograms in this area. I think there's a lot of reasons. Some of it's insurance driven, lack of insurance to cover the procedure and having to come up with that self-pay fee. Everybody thinks, what do you hear about mammograms? It's so horrible. I don't want to get squished. It hurts. So obviously pain is a limiting factor.
But of course, that's obviously better than receiving the alternative, of course.
And I think another misconception is women think, I don't have any family history, so I have no risk for it. So why do I need to do that? Or I do monthly breast exams, so as long as I'm doing that monthly breast exam, I don't need a mammogram, because if I feel something, then I can go have that addressed. But the goal of mammogram is to find something abnormal long before you can feel it.
And of course, we are starting to see more survivors. We're starting to see those numbers increasing a little bit too. Where do we stand? I know there's obviously going to be more and more research, but the fear is there. It's obviously a scary word, but there is a light at the end of the tunnel as well.
Oh, definitely. We've come a long way over the past 20 to 30 years, and actually the survival rate for early stage breast cancer is not over 90%. So, the goal is finding something early, getting your screening mammogram, and allowing us to help you be part of that 90+%.
All right, well, folks, you heard it from her, and we're going to put the information up on the screen. There it is. If you have any questions, you feel free to call them. It is 778-PINK. Easy to remember. Again, 778, that is 7465. You can also go to the website, which is erlanger.org/breast health. And we certainly appreciate you stopping by today.
Thank you.
All right, folks.